Hi everyone, my name is Olivia Falcon. I'm a beauty journalist and I'm here today talking to the lovely Dr. Priya Verma about a fairly controversial but very powerful tweakment, endolift. So I have in the past gone on record and I've done a podcast and I've been quite vocal in my thoughts on endolift. I've never tried endolift because I haven't really felt that I was an appropriate candidate for it. And I know you have to pick your patients very carefully for this treatment, which is what we're going to discuss a bit later. But Priya, will you start by just telling us what is in endolift?
Absolutely, thank you Olivia. So endolift is a laser-based skin tightening treatment, and it uses a really fine micro-optical fibre that passes under the skin.
This one
and
here?
You can see it here, and it's quite, a versatile, bendy little wire. So this instrument has laser light shining out the end of it when we connect it to this machine. And what we're doing is we're delivering laser energy into the deep dermal layer. And what that does is it generates heat into the skin. And the heat can do one of two things, or both things. It can remodel collagen, so it induces thermal trauma, controlled thermal trauma into the skin, which kickstarts the production of collagen stimulation. So that gives us the skin tightening. However, in some patients, if we wanted to melt little pockets of fat, so little stubborn areas under the chin that we get, or jowls, which are a common concern in my clinic, we can actually change the energy setting, generate a little bit more heat, use a slightly different technique and address those jowls, submental fat, and melt away very gently the fat under the skin. And your body will just clear away that melted fat over time to then give you a more sculpted, contoured appearance in the lower face. But it can be used in more than just the face. We can use it, yes, lower facial third, under the chin and the neck, but we can use it for malar edema. We can use it on the body to tighten skin, melt little pockets of fat.
Finger wings,
postpartum abdominal
tummies,
skin laxity. Yeah. It's brilliant for that, inner thighs. We can even use it for things like cellulite and
knees,
acne scarring.
tops of knees.
Tops of knees is very common in my practice. But yeah, it's quite a versatile treatment.
So Priya, let me ask you though, I've always been quite adamant that I think that this treatment is really best in the hands of people that are doing facial surgeries because it's powerful. If you're in the wrong plane, you're too deep, you're too shallow, the ways in this can go wrong can be quite dramatic. What would you say to that? Because you're a doctor, you're not a surgeon, but I would, if you argued to me that you are probably the most experienced in doing this treatment in the UK, I would probably say you are, because how many treatments have you done?
Over 1,000 now.
Okay, but talk to me about this, because I think people out there really want to know. It's all about finding the best practitioner who's the safest and has the most experience. What do you say to that about,
who should be doing it? I think it's a really important question to address, Olivia, and I think my stance on it is this: regardless of which procedure we're doing, when it comes to non-surgical aesthetic treatments, absolutely, experience and skill level is key. You are using an instrument underneath the skin, so technically this is minimally invasive skin tightening, but I think there's a learning curve to everything, and when it comes to understanding which layer of the face we're in, whether it's the superficial dermis, whether it's the deep dermis, the subcutaneous fat layer, whether you're, working with injectables underneath the muscle and underneath the deep fat on the bone, there's an appreciation of which layer we're in for not just laser device treatment, but also injectable treatments as well. And one could argue that the majority of non-surgical injectable treatments are performed by non-surgeons. So my answer to this with regards to endolift specifically is you need to have a degree of experience. And so I'm an international trainer. I've been training people in endolift for well over 5 years now. And the one thing I always say is when it comes to using a tool under the skin like this, that like you rightly say, has the potential to cause damage because we're putting heat there, I would say it takes at least 50 cases to get comfortable with it. And only when you've really done 50 cases, working with conservative energy settings, understanding the technique, guiding that micro-optical fibre into the correct layer of the skin, can you then start doing more complex cases or doing more powerful treatments, which involve a little bit of fine-tuning with the settings, then of course you're going to keep your patients safe, you're going to feel more comfortable because you've had sufficient experience in getting the basics right. But I don't think that we necessarily need to segregate this procedure or any other energy-based device that we use for skin tightening that potentially is minimally invasive to just one cohort of medical practitioners. I think it all boils down to skill level. And I say the same for thread lift procedures, even dermal fillers, for example, because to do a dermal filler treatment well, you want to go to someone who does it day in, day out, dedicates their career to understanding facial tissue and having done lots of these procedures, can iterate their method in order to get better results for patients that they continue to treat in future. So absolutely, I think having an endolift procedure with a medical professional is key. So we currently train doctors, so GMC registered doctors, of course surgeons, dermatologists and dentists, because we feel that the company feel that those medical professionals have a sufficient degree of experience with facial anatomy, but also complications should they arise. And so that's my stance on it, making sure that you've done a sufficient number of treatments before you start experimenting with the energy settings.
Okay, great. Now, the other problem though is there are lots of counterfeit machines out there.
That's right.
And there have been quite a lot of reports of burns and problems. Can you just explain how to know that you're getting the proper endolift treatment and it's not a counterfeit?
Yeah, this is an issue that we're really struggling with at the moment. I mean, I regularly get messages from patients saying, Dr. Priya, I've had an endolift procedure, and they call it an endolift procedure, and I've had terrible burns, or I've had terrible swelling and downtime, and I've had a nerve injury. Please, can you help me? And actually, when you investigate what happened, they've been treated with a counterfeit device that wasn't the original LaserMar 1500 by Ufiton, an Italian company that's very well established, been around for over 24 years, working with lasers and laser technology. And they've actually had a device that is an endolifting machine that was probably bought on Alibaba. And if you were to Google endolift machine into Alibaba, you'd be able to pick up one for about $500. And what's really scary is that I've even done my own research. I've had practitioners messaging me saying, Priya, did you know there's a beautician out here who's posted on Facebook saying that they're running endolift training courses out of a salon. And they have absolutely no medical expertise whatsoever. We don't know how well regulated these devices are, if at all. We don't know what the fibers are doing. We don't know how they've been cut. Because of course, when this passes under your skin, this is a single use. This one's been disinfected. This is a single-use micro-optical fiber, and you can't cut this. If you talk about cutting it so that you can use it on somebody else, it completely changes the laser emission pattern. If you were to look at this fiber under a microscope, you would see that its point and its linearity or its radial emission has been perfectly fine-tuned, and a lot of research and development goes into the creation of these fibers by Ufiton. And so it really is a science in itself. So there's lots of replicas. It's a dangerous industry in some sense for the consumer. It's very difficult for the consumer to know. But what I would say is to any consumer thinking, any patient thinking about having an endolift device, or endolift treatment, is to ask the right questions. So you need to ask, what are the expertise of your medical practitioner? Do they hold a medical degree or a dental degree? How many procedures have they done? Which device do they use? Can they send you a certification document to prove that they have bought the original LaserMar 1500 Ufiton endolift device? And if it's not that one, which one is it? There are a couple of other competitors. They're not necessarily counterfeit devices, but they are not the original endolift device. And so I think, it's all about understanding, gathering the right information. And if you're ever pushed into having an endolift device without a consultation, for me, that should send alarm bells ringing, because before any endolift procedure, I have a very strict consultation first approach. We do not perform endolift on the same day as consultation. It is something that you do need to go away and think about. There's a lot to it. As with any procedure, there are risks, side effects, complications. You need to think about whether this is the right time. How would you feel if you did have a complication? Of course, they are very rare in the hands of a trained professional, but there should never be any coercion or rush to do a procedure like this.
What are the complications? What can go wrong?
So when you're passing a fibre under the skin, a micro-optical fibre under the skin that puts heat into the skin, there's a few things to consider. First of all, we have to put local anaesthetic into the skin. So that's usually a liquid preparation of lidocaine, which is what the dentists use, mixed with salty water called saline. And so what I do is I infiltrate the skin, passing little droplets of liquid under the skin in, let's say, for example, the lower face and neck. And with that, we have to use a cannula and a needle. So that could induce some redness, some swelling, some bruising, and that forms part of the side effect profile. Then once we go laser to skin, we need to think about what happens when we put heat into the deeper layers of the skin. Now there are nerves in our face, and there's two types of nerves. So there's sensory nerves and there's motor nerves. I always say that about 80% of patients will have some numbness after procedure, and that will last about 6 to 8 weeks, and you'll find that that's getting better week on week. But that's because we're putting heat near all the sensory nerves, and we can't miss them, their branches are tiny. But that can that can cause a little bit of irritation.
And you can feel like you have little pins and needles. Exactly. And numbness.
Yeah.
I think you have a facelift. This is exactly. Also a common symptom after a facelift.
It is.
But usually the nerve it returns. Yeah.
Yeah. So the nerves will regenerate and the feeling will come back. So it's certainly not a permanent issue.
Do you ever scan the face?
So typically no, because this is a nerve structure and it can be quite difficult to view with things like an ultrasound, for example. Mm-hmm. I think also because of the nature of this nerve, its course varies. So you could hit it at multiple different points.
Right.
So despite, I think practitioners could potentially get lulled into a false sense of security doing some imaging prior to doing endolift, when actually you might become a little bit complacent because you think you've marked out where it lives, but you are working holistically on the lower face. You're working under the mandible, which is under the jaw, and there is an area where it can sort of tuck in there and become more superficial there as well. So I wouldn't say that's going to guarantee you avoidance of this complication as well.
And if things go to plan, which we hope they do, what are the results like and how long do they last for?
So patient selection really is key. Results vary, of course, patient to patient, but I think from our perspective as practitioners, it's our duty to say, you're a good candidate, but you're not a good candidate. So, I turn a lot of patients away because after having a discussion about realistic expectations, some patients say, well, that's just not the result I'm going to be looking for. And so then we say, well, it's probably not for you. But for the ideal candidate, somebody who's got really good healthy skin, so a nice thick skin, and they've got a little bit of superficial fat that we can work with, which protects you from nerve injuries as well, and they've got a little bit of mild to moderate skin laxity with a little pocket of fat that might need a bit of melting. That's the ideal candidate for me, and that might come at different decades of life depending on how well you've looked after your skin. But in those sorts of patients, if we are aiming to tighten the skin, gently melt a little bit of fat, then what we tend to see is a reduction in the jowl volume. So volumetrically, the jowl shrinks. Under the chin, I've seen beautiful reduction in double chin fat as well. We see that sort of loose bandiness that isn't coming from the muscle, the platysmal muscle, but it's actually just redundant skin. That can tighten. The degree of tightening and the degree of fat melting, which patients often ask me, what sort of percentage are we talking about, is really difficult to answer.
It varies from case to case.
It really does.
And how long does it last though? Once the fat is gone, it's gone.
Exactly.
Right?
So fat melting is permanent because of course once you've induced apoptosis of a fat cell, it's lysed open, it's seen as a debris, a foreign substance that actually your body's lymphatics drain away over a period of weeks. The skin tightening typically in my practice lasts about 2 years, sometimes 3. And I can attest to that because, I've been using this for 5.5 years now. And that's the typical time point when patients come back. And actually what's really nice is when we talk about, what do heat treatments do under the skin? What is it like to go back into the skin? Well, I do have experience of that. I've gone back into the skin of a patient who's had endolift before. And actually the glide is just as easy as it was 2.5 years ago. And that fills me with confidence. And of course, that's dependent. Later. But if we have, a mindset that let's go in and blitz the skin with lots of heat, well, maybe that patient's not the right patient, the right candidate to start with.
So maybe this is a good solution for people who absolutely, it is a game, they do not want to go under the knife under any circumstances. So maybe endolift is a good alternative for people that have the jowling and the little fat pad here facially. Talk to me about the treatments on the body, because obviously that's not, you can still obviously do damage to the tissues of the body, but you're not dealing with, your bottom lip,
exactly,
not working properly. So are you treating a larger area? Are you getting just as effective results?
With the body, I'm actually super selective. I have a lot of interest in body treatments. The key here is, again, it boils down to consultation. We have to ensure that patients are at an optimal weight. If they're on a weight loss trajectory, then I always say wait until you've got to a stable weight and then consider tightening the skin. If you want it to melt larger stubborn pockets of fat on the body, it's probably not going to work very well. We do have higher caliber fibers, so these wires, they come in different sizes. We typically use a smaller wire for the face and neck, and then we go into larger caliber fibers for the body, because we want to have more laser penetration through the skin in order to help with more dense fatty tissue. But what I do say is that when it comes to the body, if you've got skin laxity and you don't want to go under the knife, and actually for areas like the thighs, if you did think about the surgical alternative, it would leave you with a pretty big scar. And patients aren't prepared to do that.
And on the arms as well, you have the scar all
You'd
the
have
way.
a very big vertical scar. Yeah. And so that's why this is a fantastic alternative, because it can help with tightening up loose skin, and it pairs very nicely with injectables as well. So I've been using endolift in combination, which is, with bioregenerative treatments, such as polynucleotides, such as polylactic acid. And those things are just gold, because you're doing a dual layer treatment where you're working on the deep dermal remodeling with endolift, and then you're working on the superficial element of the skin with other injectables. And so the result is actually really natural. You're not causing undue damage to the skin, because you're going in for a treatment where you don't have to use aggressive settings. So for me, I love treating patients on the body who have got a concern about loose skin, as opposed to lots of heavy, unwanted fat.
And do you think you're seeing lots more people now who are taking the weight loss injections coming in with loose skin concerns? Yeah.
It's been on the rise since last year. Increasingly, patients are saying, look, I'm delighted about the weight loss, but I'm really, really unhappy with the loose skin. And so body treatments have just soared in my clinic, and I'm doing a lot more body treatments. And in areas that we haven't really seen it before. So the inner thigh is an area. The area just below the buttock, the subgluteal fold, that's becoming a bit loose. And of course the arms, you see it first there. And that's difficult because in the summer patients want to wear, like, you know, they might want to wear a sleeveless top. They want to feel comfortable wearing those sorts of clothes. So body confidence has become a bit of an issue. Endolift, we're seeing really lovely results with it. And we might do 2 sessions as opposed to 1 session, the lower face and neck, because here I think heat delivery, being quite gentle, is very important to me.
How many treatments could one have accumulatively over the years?
So you have to remember that for the UK, I can only really speak for the UK, it's been around for about 5.5 years. So we don't have longer term data on that from the practitioners in the UK. But there's some patients who I've treated 3 times. And it's been no more difficult to go into the skin. It hasn't felt like they've had heat-based treatments before. The glide has been just as easy, and the result has been just as effective. And if anything, I think the mindset changes when patients come in and have a procedure that's a little bit more involved or that's a little bit more expensive, because then they think differently about how they're going to care for their skin. Suddenly there's an overhaul in the way they do their home skincare routine. They feel committed to the process of changing the health of their skin. And so in between that 2-year period where they're having endolift, they're also doing microneedling, or they're doing some bioregenerative treatments. They're doing, you know, skin rejuvenation, skin booster treatments, and actually the skin's in even better condition than when we first started.
And how much roughly are you looking at for a sort of jowl area, to rejuvenate a jowl area with endolift?
In terms of cost?
Yes.
So for lower face, under the chin and the anterior neck, which is our standard sort of lower face and neck protocol, prices vary across practitioners, but it can be anywhere in the region of about £2,500 to £4,000.
Okay, and for like a body area, for an arm, for a bingo wing, for example, how much does that cost?
So body treatments require more anaesthetic, more time, sometimes more fibres, because we might want to use something to melt fat, different fibre, and then another one on a slightly different layer of the skin to tighten the skin. And so the cost increases, and it will be usually from about £3,000.
What does a normal downtime look like with endolift? What can you expect? So on the face and neck?
So the typical downtime after endolift is about 3 to 5 days. And if we're doing skin tightening, it can be even less than that. To the point where a patient will get up off the couch, they'll be a little bit red. They'll be red until maybe later that evening. They'll be a bit puffy because we might have just put 20 to 25 mils of liquid anaesthetic in the face, but a lot of patients with skin laxity quite like that look. There may be some bruising, which they can cover with makeup after 24 hours, but usually by the next day they can go back to work if they feel comfortable with a little bit of swelling, and they can carry on with their daily duties as normal. But if we're doing fat melting, we're putting more heat into the skin, and so that induces a bit more swelling of its own. And so you might have a little bit more swelling, so a bit more puffiness. That could take up to about 5 days to settle down. You might have a little bit more bruising as well. But honestly, most of my patients, you know, they're fine to go back to work the next day. They look completely presentable when they leave here, and most of them will go off and have dinner straight after treatment.
And how do they feel? Is it tender in the area? You don't have to do any massaging or, you know, do any sort of specific aftercare, do you?
So the aftercare is really simple. The only thing I do ask patients to actively do is massage. So once upon a time, there were patients who, you know, practitioners who were advocating for facial compression garments after endolift. Now, if you think about how endolift works, you've just induced a bit of swelling. You may have just melted some fat. You want clearance of that fat. So really what you want to do is encourage the lymphatics to clear away those melted fat cells. So what I advise patients to do is twice a day for about 1 to 2 minutes per time is to massage the face in an upward-outward direction.
Well, thank you so much for sharing this. It's been really an education for me today, and I would say for anyone considering this treatment, you really need to do your research. You need to see a medical professional who has done a big volume of cases. You will have to ask them about their complication rates, how they would treat you if anything were to go wrong. and you just need to be incredibly informed. But good luck, and thank you, Dr. Priya. Thank you very much.
Pleasure. Thank you.